I've been involved in drug testing, in sport competition, and dope control for over 20 years. In fact, since 1985, I've been overseeing a world federation of over 170 countries in sports training and sports medicine in terms of doing and designing drug testing programs, random, out-of-competition control, and so on. And there's a lot of misunderstandings and misinformation, even disinformation, on the use of human growth hormone, HGH, and other types of medications within the athletic community, and wrong information to the general public. Anabolic steroids are specifically testosterone-derived male hormones, and this is a substance that athletes have used in supernormal, very high, super physiologic dosages, and this is something that we ban in sport. But there's a big difference between growth hormone and utilizing anabolic steroids. Growth hormone is not a male hormone steroid. It is something that is produced naturally in the body. It is something that is, if used therapeutically in seniors for growth hormone deficiencies, it can have very positive, profound effects on the patient. HGH used for patients with somatomedin or growth hormone deficiency syndrome, what it does is it can begin to reanimate their energy levels, help them to grow their lean muscle mass, lose body fat, increase their energy, their strength. Generally, their whole well-being and their outlook on life can change, as well as their physiology can change quite dramatically. But again, we're talking about therapeutic dosages. These are 1/5 to 1/7 that you would give to a child. And there's very few drugs in the medical compendium where you give a fraction of what you would give to a pediatric dose that would cause any issues. Now, there's been a lot of things in the scientific literature and sort of non-supported articles saying that these things cause cancer, where there is no association between growth hormone and cancer in terms of strict double-blind objective studies published in the peer-reviewed literature. There's no basis for those statements. In terms of carpal tunnel syndrome or some water retention, these things go away when you drop the dosages. That's for patients who are being medicated improperly. But if they're medicated at therapeutic dosages, if these syndromes occur, you drop the dose, or if there is a problem, you just stop the use of this modality in that patient, like you would with any therapy that was not working effectively. Also, hormone replacement, whether it be with growth hormone or testosterone, any of these things, are not for every patient. They're only for specific patients that have specific needs and physiologic imbalances that need to have adjustments, and these things need to be carefully followed and titrated with these patients. But the ironic part of this whole issue of drug use in sports is in the next 4 to 8 years, it will be a non-issue completely. Gene doping and genetic engineering is now coming into play. Probably in the Chinese Olympics we'll begin to see the beginnings of this, and most certainly by the next Olympic Games, anabolic steroids, growth hormone, all these things, in the terms of sport controversy, will disappear because they're not even going to be bothered with anymore. Because now athletes are going to go directly to genetic engineering and gene doping, which is not detectable in the blood. It is not detectable in the urine. It's only detectable by muscle biopsy. And it's going to be pretty tough to get muscle biopsies from athletes during sport competition. So we need to try and clear up the difference between growth hormone and utilizing anabolic steroids. Growth hormone is not a male hormone steroid. It is something that is produced naturally in the body. It is something that is, if used therapeutically in seniors for growth hormone deficiencies, it can have very positive, profound effects on the patient. But to merge this in one blanket affair and saying growth hormone is bad, that people are dying from it, all these are scientifically unproven and nonsense, but it really does a disservice to the patients that we're trying to help who are above the age of 40, 50, 60, and 70 years of age who could benefit from specific therapy.